Good evening everyone. Myself Dr. Sri Charitha. My title is to assess the clinical features of dry eye in thyroid associated ophthalmopathy. Aim is to evaluate the clinical features of dry eye in thyroid associated ophthalmopathy. Methods: 42 eyes of 22 patients with TAO and 80 eyes of 40 patients without TAO were included in this prospective study. Schimmer's test was done and assessed. Results were then compared with the patients with TAO and without TAO. While comparing these two groups, irritation, foreign body sensation, itching, proptosis, ocular discomfort was present in group 1 patients, and in group 2 all of these were absent except the proptosis, which is present in both the groups. Mean Schimmer's test is 13.4 plus or minus 7.32 mm and 23.9 plus or minus 4.57 mm in group 2 patients. Discussion: two groups were taken, and group 1 which included 22 patients and group 2 which included 40 patients. And the clinical features of dry eye such as irritation, foreign body sensation, itching, proptosis, ocular discomfort were assessed. Schimmer's test was done in both the groups. This test measures total tear secretions. It is performed with the help of a 5 into 35 mm strip of Wartman 41 filter paper, which is folded 5 mm from one end and kept in the lower fornix at the junction of lateral 1/3 and medial 2/3. The patient is asked to look up and not to blink or close the eyes. After 5 minutes of the wetting of the filter paper strip from the bent end is measured. Normal values of Schimmer's test are more than 15 mm. Values of 5 to 10 mm are suggestive of moderate to mild keratoconjunctivitis sicca, and less than 5 mm is suggestive of severe keratoconjunctivitis sicca. Thyroid ophthalmopathy. Thyroid ophthalmopathy is an autoimmune disease in which autoantibodies against the thyroid stimulating hormone receptor are produced. Clinical features of TAO include exophthalmos, retraction of the eyelids, and restriction of the eyeball movements. Dry eye. The trigger mechanism of dry eye in patients with TAO is exophthalmos, retraction of eyelids, and the fibrosis of the levator palpebrae muscle. Reduced tear production and changes in tear composition are associated with the dry eye. Result: the mean Schimmer's test was 13.4 plus or minus 7.32 mm and 23.9 plus or minus 4.57 mm in patients with TAO and without TAO respectively. The mean proptosis did not show any difference between the TAO. Conclusion: dry eye is common in patients with thyroid associated ophthalmopathy. Thank you.